Hi everyone, I'm Derek Flerlog, Director of Business Development and Admissions for Tanglewood Health and Rehab here in Topeka. Just wanted to do a short update for everybody, most notably the families of our residents here at Tanglewood and for the community as well. So I'll start by saying that we currently have and have had 0 suspected cases of COVID-19 coronavirus here in the facility, and obviously with that, no confirmed cases either. So we've been very, very proactive. Um, you know, for a couple months now. We do have a check-in station up front for employees. Obviously, we're following CMS regulations and guidelines, and so no visitors at the moment. And but one of the things that we're doing is a check-in station up front for every employee that walks through the door. Uh, we do a temperature. We have a temperature log, a symptoms log, where you have to basically give any symptoms that you're having, and then a questionnaire that's filled out daily as well. So, trying to track whether someone has had any interaction with somebody else that has maybe been exposed or has had a chance to be exposed. And so we're following those guidelines. And, I think we've done a very, very good job about that. We have dedicated staff to each wing. We have 3 wings in the building. And so staff are dedicated to each of those. And so no intermingling between staff and residents of various halls. And so just a couple different things that we're doing here. Of course, infection prevention, washing hands, gloves, sanitizing countertops and all the surfaces in the building, the handrails along the walls. Housekeeping's doing a really, really good job about that. And things have been difficult. There's no doubt about that. I think it's been really, really difficult for families and residents because we have so many families that prior to this were involved daily, visiting the facility, visiting their loved ones, bringing in supplies that their loved ones need. I mean, there was just so much interaction that they oftentimes became people that we knew just like their loved ones here in the building. And obviously with CMS's regulations, we can't do the visitations anymore in person. But like I said, utilizing video conferences, video messaging, Facebook, using our phones and tablets and different devices that we have here in the building, and just trying to be creative with it and keep our residents as up to date as we can, as involved as we can with different activities. Of course, again, no group activities, following the 6-foot rule, and just being smart about things. The hair's growing out, the beard's growing out. We actually have a nurse here on staff who went to cosmetology school, so she's been able to do some haircuts and things like that. And we just feel really, really lucky to have the staff that we do. So shout out to all of our wonderful staff, nursing, housekeeping, dietary, all of our administrative staff that has done just an amazing job to keep our facility up and running just as it was before. Just a little extra, some extra rules on top of that. So we're going to keep going. I'm going to try to do these weekly updates and, of course, be as transparent, as honest with everyone that I can. And I just want to urge any family members or community members or partners that have any questions, please don't hesitate to reach out to us or me personally. And like I said, we're just going to be as honest as we can and go from there. We will get through this difficult time. It's just going to take a little extra work to get there, but we're up for the challenge.